So today we are going to recap some of the exercises and highlights of the Let's Talk Back workshop. First of all, we have a replica of the spine. So this is facing front and facing back. And what we're mostly working with today is the sacroiliac joint. So this is your sacrum by what sometimes we call the tailbone. And it's a joint that lies between the two big bones of the pelvis. And this rounded piece here is called the ilium. And in the back, we refer to it as the PSIS, the posterior iliosacral joint. So this sacrum lies between and is held in place by lots of ligaments, mostly ligaments. And what happens is if we overstretch, stretch improperly, stretch too much or too little, we can create a shearing force in between this joint, the sacrum and the ilium, that would cause inflammation, or we can overstretch it. Now all the muscles, and there's over 40 muscles involved in the pelvis itself. The pelvis is like this cradle of movement for our whole body. And those muscles do provide support and tensegrity in our structure, but it's mostly the ligaments that we're talking about, in particular when we're dealing with SI joint dysfunction. So misalignment is the most common form of irritation and low back pain. The SI joints, again, you can have symptoms that look like low back pain, feel like low back pain, but are in fact caused by irritation, misalignment, dysfunction in the SI joint. So first thing that we're going to do, I'm just going to set this over here. The first thing that we're going to do is called a pelvic reset. And this work is borrowed, and I credit Donna Farhi, F-A-R-H-I. Feel free to look up her work, her workshops. She does a lot of work with the pelvis and the SI joint and dysfunction around that. So this work comes from her. We're going to do just with a strap first, and then we're going to use blocks. So grab a strap, grab a block. Meet me on your back. We want to make a loop with our strap. And again, you can use, if you'd like, a belt from a bathrobe, for instance, if you don't have something. And we're going to lie on our back. And I don't want you to have your feet too close to your glutes. So have them a little bit away. And you can sort of see the angle here. I'm not at a 90-degree angle. I'm more at a maybe 75-degree angle. And you do want to feel your heels, your toes, so maybe lift your feet, place them back down. And we're going to tighten our belt and bring our feet together so that our feet are touching. And then I also want you to feel the upper back. So lifting your shoulder blades up, your arms up to the ceiling, lifting your shoulder blades from the mat, setting them back down on the mat, and then having your arms alongside your body, palms down or face up. And all we're going to do here is we're going to take 3 deep breaths as we press our legs out against the strap. And inhale 3 times. Exhale, press out. Inhale, press out. Exhale, press in. It's not a big movement, just a subtle movement. And exhale out. Inhale in. Beautiful. Now, loosen your belt a little bit. And then take your feet maybe maybe hips distance apart, maybe not quite there. And see how this feels. Same sort of thing. Feet stay on the mat. Now feel a little bit of weight on the arches side of the feet as you inhale, 2, 3. Now press out, feeling a little bit more weight on the outer edges of your feet, 2, 3. Inhale, roll in a little bit, press in, 2, 3, and exhale, 2, 3. Last one. Inhale, 2, 3, and exhale, 2, 3. Now you should feel a little bit of movement, maybe a little bit, if you already have some low back pain, you might feel an awareness, a sensation around the SI joint as you squeeze out, as you press against that strap, and then release back in. So exhale as you press out, and inhale as you release in. Then last, we're going to make our strap a bit wider, and we're going to start with our block. We're going to start with our block this way. So we're going to take the block this way, place it between our thighs, so make sure you have enough space in your strap, and then maybe take your strap over the block. So if you were to look down, your hips would be approximately hip distance apart. They might be slightly wider. Okay? Now, if this does not feel comfortable at all, change the dimension of your block and take the block and make it put this edge in between your knees. Well, let's start with the widest one here. So again, your feet are not, they're about 75-degree angle, 80-degree angle from your glutes. And then squeeze the block in, 2, 3. Now press out against the strap, 2, 3. In, 2, 3. And out, 2, 3. Last time, in, 2, 3, and out, 2, 3. So, if that felt at all irritating, take your block a little bit in the smaller direction, tighten your strap, and then do the same exercise. Press out, 2, 3, and in, 2, 3. And do that for a few sets. Find which one feels the most comfortable and gives you the most awareness of movement in that SI joint. And then when you're done, let's just take our strap. We're going to take it around off of our legs. And then I want you just to lie here on your backs with your feet on the mat. And gently move side to side with your knees. So here you should feel, as you come to the left, a roll, a little massage over that left SI joint. And then to the right, the same thing, a little roll, a little massage at the right SI joint. So notice which one may feel a little more irritated, sore, tight, tender for you. For me, it's my left. I always notice that when I bring my knees towards the left, I feel a bit more pain than when I come to the right. So notice how that feels. Now, another pelvic reset we can do is we're going to grab our straps again. And I'm going to start with my left leg. I'm going to wrap the strap around the heel. I'm going to leave a bit of a bend in the left knee. So it's not completely straight like this. I have a little bend in the left knee. I'm going to wrap the straps around my hand. So that little bend, and my leg is pretty straight up to the ceiling and the foot is flexed. Now what I want to do here is I want to push the strap, pull the strap down, and so I feel my leg kind of plug into the left hip socket. So a pull down on the strap, plugging that leg into the hip socket. Perfect. Now I am going to turn my ankle towards the outside, towards the inside, and then just draw my foot over to the right, and then let my right knee drop in to the middle of my body. And you should feel a bit of a stretch here on the left hamstring, so you might feel that. Deep breath in, and a deep breath out. Another one, so hold for 3. We're still pulling that strap on the heel, so our leg is plugging into the left hip socket. One more deep breath here. And back to the center. Release. And we're going to switch feet. So now our right leg is going to come up. Heel to the ceiling. Left foot is on the ground. Pull the strap. Feel the right hip plug into that hip socket. And then just turn your ankle, invert your foot towards the center of your body. Draw that leg to start to bring it over maybe 10, 20 degrees, and then let the left knee fall into the inside. 3 deep breaths. And one more. And back to the center and release. And then let's make that little movement again with our hips, feet on the floor, and gentle movement side to side. Notice if there's a change in the SI joint. Good. From here, let's come up to a comfortable seated pose as we prepare for our next pelvic reset exercise.